Welcome everyone to this hour celebrating the Millennium Development Goal 4. This is the hour that we're going to be talking about the very important task of reducing child mortality worldwide. And this is, of course, a very important day to have this discussion. We are 500 days out from the world's most important deadline, the deadline of reducing childhood mortality as set by the Millennium Development Goals. These are the world's biggest to-do lists, and here we are discussing goal number 4, reducing childhood deaths. This is really an important goal for not just me, but for the other people who are going to join us this hour on this call, not only because we all believe in the future that these children should have and the very important task of ending preventable deaths among children, especially under the age of 5, but we also know that progress has been made in this particular Millennium Development Goal, and I'm here to tell you a little bit about that. So many kids in countries like Ethiopia, in countries like India, and countries like Mozambique do not make it to their 5th birthday. It's a pivotal milestone for them. So if you feel like you want to do just a tiny bit of social good today, we're going to tell you how you can get involved. I'm going to tell you about a very important campaign called Shot Life, which has dedicated itself to ending childhood mortality by increasing access to childhood immunizations for children in developing countries. These are the most vulnerable children, the marginalized children, the children who really are the hardest to reach in parts of the world that we perhaps have never even heard of or witnessed, but we really want to be able to make a difference there. So let me tell you a little bit about the progress that we've already made, because there is some good news in MDG4, and that's one of the most important aspects that we want to talk about this hour. Gains have been made in child survival since 1990. Worldwide, the mortality rate of children under 5 dropped by 47% since 1990. That is incredible, the strides that we're making. From 90 deaths per 1,000 live births in 1990, we are now at 48 deaths per 1,000 live births. But that's still 48 deaths. That's 48 deaths, most of them of which are preventable. So despite this accomplishment, more rapid progress is needed to meet the 2015 target of reducing childhood deaths by 2/3. We are looking for a 2/3 reduction in under 5 mortality. In 2012, an estimated 6.6 million children still died. That's about 18,000 a day, mostly from preventable diseases. And I want to tell you the story of measles and the role that a small vaccine like the measles vaccine has played in this incredible fight to end childhood deaths. Measles vaccinations rates have gone up so significantly in these countries, resulting in a 78% reduction in measles deaths. We're talking about a disease that used to be the leading killer of children in developing countries and no longer is. In fact, people will have actually told me, as the director of the Shot Life campaign, that the measles vaccine has been responsible for over 20% of the progress that we have made in MDG4. And this is why it's so important for campaigns like Shot Life that urge people to get out there and advocate for childhood vaccines, that urge people to fundraise for these vaccines and to spread awareness that we can stop a child's death every 20 seconds by increasing access to vaccines. That's why this campaign is so important. And so I'm really excited today to hand this over to Maria Roach, who's going to take us through the next hour with a very compelling list of panelists. Maria is the president of Roach Media, a Maryland-based media consulting firm. She is an award-winning former network news producer for Dateline NBC with a lot of experience in investigative reporting. She has worked for the last 20 years in children's health initiatives, including organizing a citywide event in New York City for Hope for Kids International. This year, we were very lucky because Maria joined us as the UN Foundation's Shot Life champion, and she came to us from one of our favorite partner organizations, MochaMoms, a mission-driven group of moms around the country interested in saving children's lives. Maria is a wife and a mother of 2 sweet little boys. I hear you. I'm there too, surrounded by men. She believes every child should have a shot at life. Thank you so much for joining us today, Maria.
Debbie, thank you so much for having me. And excited to be a champion my first year with Shot Life, and I think it's so important for women to know that we have the power to make a difference in the lives of children all over the world. Of course, we want dads and brothers and sisters and aunts and uncles and grandparents to be involved as well. But this is really exciting as a woman, knowing that I can help other children have the same shot at life that my children have. My boys are now 8 and 9 years old, and I really want so many 5-year-olds across the world to reach 8, to reach 9, to enjoy 3rd grade and 4th grade and then all the many other years that we can provide to them when we help a child get the life-saving vaccines. So thank you so much for having me here today. I want to introduce some of the other amazing women who are joining us today for the United Nations Millennium Development Goals. It's 500 hours today, which is exciting, and we've got some pretty incredible women who have their own personal stories of why they are here supporting Shot at Life. First, we've got Alina Un, who was born in India. This is a fact that she says taught her the power and importance of vaccines firsthand. She loves the UN Shot at Life program because she says it brings our world closer and opens up the sisterhood of motherhood. And yes, it does, Alina. Alina says we're talking about saving the lives of children and the hearts of mothers. She traveled to Uganda for Shot at Life in the fall of 2013 on a vaccination trip. For her, she said it was the experience of a lifetime. Alina has an excuse me, an MS in Integrated Marketing Communications from Northwestern University. She's a doting mom, a blogger, an Audrey Hepburn fan. Yes, I join you with that, and a shoe aficionado. Next, I want to introduce Danielle Fox, who is the current national president for the Student National Pharmaceutical Association. She's a 4th year and a Doctor of Pharmacy candidate at St. Louis College of Pharmacy. Danielle is an active member of Kappa Psi Pharmaceutical Fraternity and is passionate about meeting the needs of the underserved. She received her bachelor's in communications disorders and psychology from Truman State University in Kirksville, Missouri, and was born, or should I say Missouri, she was born, raised, and plans to practice in St. Louis, Missouri upon graduation. And I think, did she join us? Yes. And last but very not least is Dr. Margaret Meg Fisher. Dr. Fisher is the medical director of the Unterberg Children's Hospital and Monmouth Medical Center in Monmouth County, New Jersey. She's also co-chair of the Academy's Global Immunization Project Advisory Committee. Dr. Fisher, or as she'll tell you to call her, just call me Meg, she is remarkable. I had the pleasure of meeting her this year at our Champions Summit here in Washington, D.C. She is highly regarded pediatrician by her peers nationwide, and I can tell you by many families nationwide and worldwide. She's working with the American Academy of Pediatricians to establish national guidelines and standards for quality health care for children and adolescents. So these are all of our panelists, and without further ado, I'll ask Dr. Meg Fisher just to start off by telling us why you're so passionate about children's vaccinations. Is everyone able to hear Dr. Fisher?
No.
No, I think her mic might be off or muted.
Yeah, she is muted.
Meg, we can't hear you. Are you? I'm sorry.
Here we go. Now can you hear me?
Okay.
Oh, yes. Yes, we
I'm
can.
sorry for wasting your time on that. Here we go. Let's try it one more time. I am passionate about this because I'm an infectious disease doctor, and I started practicing in 1975. At that point, we had a lot of vaccine-preventable diseases here in this country. And over the last more than 35 years, what I've gotten to see is a dramatic decrease in illnesses here in the U.S. We've eliminated polio, measles, rubella, and almost eliminated tetanus, diphtheria, Haemophilus influenza type B. We've seen dramatic decreases in mumps, chickenpox, hepatitis A, hepatitis B, human papillomavirus, as well as pneumococcal meningitis and rotavirus disease. But we haven't done quite as well in the entire world. And what I want to do is really get us as enthusiastic worldwide as we are, or as successful in the world as we have been here. So what have we done? Well, worldwide, we've seen polio type 2 wild virus is gone from the entire world. 99% decrease in types 1 and type 3, but because of disruption, because of conflicts, we have seen that polio is not yet eliminated and in fact is spreading to some other countries. So we need new vigilance to get rid of polio. We've seen a 78% decrease in measles. In 2000, there were 500,000 measles deaths per year in this in the world, rather, and that has decreased to 122,000 in 2012. So we've gone from 1 death a minute to 1 death every 4 minutes. But we need to do better than that. And I think we probably can do better than that. In addition to polio and measles, we can introduce rotavirus vaccine and pneumococcal vaccines. And by giving these vaccines as part of the healthcare system, we can actually strengthen healthcare in general. This is an opportunity to weigh children, to measure them, to talk to parents about their other needs, to give them things like vitamin A, to give them antiparasitic medicines if that's appropriate. So these opportunities are out there, and we need to be aware of them. And with partners like the UN Foundation, the Gavi Alliance, the World Health Organization, Bill and Melinda Gates, and the American Academy of Pediatrics, I firmly believe that we can make a difference. And my plea to everyone on the Hangout is that you get involved, join the Shot at Life, and make a difference in your own community so that we can see a world free of some of these diseases. Thank you, and my apologies for muting myself.
Well, you're unmuted now, and thank you so much, Dr. Fisher. I think it's important for everyone to know that Dr. Fisher is a pediatrician first, so she is seeing every day the difference that these vaccines make, that this isn't a hypothetical, these aren't numbers, these are lives that we're talking about. And Dr. Fisher, we thank you so much for the work that you're doing. I'd like to have Alina jump in and share just why you're so passionate about it. And as Dr. Fisher talked about just the worldwide impact that vaccinations can make, if you will share a little bit just about your experience in Uganda.
Absolutely. I think that this isn't just an effort about vaccinations and global health, but like I said, we have a global sisterhood of motherhood, and I think the overwhelming, powerful feelings we have once we become moms translate across all borders. And if these kinds of diseases were hitting us at home, I think that from a humanitarian perspective, we would all be acting a lot differently, and the awareness would be different than it is now. I was born in India, and I was born to parents who were educated and had the means to give us an education and give us vaccinations, and I don't take that for granted. And I still have family back in India who are working with Rotary International and other organizations to carry on global health and Shot at Life's mission as well. And so when I went to Uganda, one of the things we got to see was family health days, and this is what Meg was just speaking about, where we get to talk about global health, not just vaccinations, where we got to weigh and measure babies, we watched them get their polio vaccinations, vitamin A, HIV tests, blood pressure tests, lots of things related to integrated health. And the point of the vaccine program is to give these kids a chance. Both of my sons were hospitalized with rotavirus, and I happen to live 2 miles from my county's only children's ER. So we were very fortunate, and I can't imagine being a mother in any of these developing countries we're talking about and not having that access. It's just kismet and luck of the stars that I am where I am. So it's nothing that I did special for my kids to deserve this literal shot at life. So I think that seeing that in other countries and hearing from moms who are no different than I am in so many ways makes it really come to life. One of the things we got to do in Uganda was sit and talk with a group of mothers. And we had a translator, and we sat under a lovely shady tree and we talked about what our dreams were for our children. And of course, those of us visiting with Shot at Life said things like we want our kids to be happy and healthy and to go to college and whatnot. And it was really harrowing to hear what some of these other mothers said, where they literally said, I want my child to live to be over 5 years old. I don't want my child to die like so many of my other children did. I don't want my child to get AIDS. These things were just not even in our paradigm. No American mother I know would ever say those things. And I think it's important for us to understand that the privileges that we have here come with responsibility and awareness that we need to help spread.
That's so true, Alina. Thank you so much for sharing that experience. And I think there's so much that you're right, we take for granted living in a country like the United States. And I think it's a great experience to see how when you share this information with a mom who didn't know that there were services available, or that we can help and work together and raise funds and raise awareness to make these services available, it's a life-changing moment because you have won her heart over by helping her keep her children healthy. And thank you so much for sharing that. And I want to now introduce to you Danielle Fox. Danielle is the current national president for the Student National Pharmaceutical Association. She's a fourth-year Doctor of Pharmacy candidate at St. Louis College of Pharmacy and an active member of the Kappa Psi Pharmaceutical Fraternity. Danielle is passionate about meeting the needs of the underserved. She received her bachelor's in communication disorders and psychology from Truman State University. And I'm sorry, I think I've already done the introduction. Have I, Danielle?
Yeah.
I have. So I'm on a little bit of a loop here. So Danielle, now it's so exciting to hear from a student, from someone who is really on the first line of looking at the medicines that are available, to learn why you are passionate about this work and what you are seeing from your unique perspective.
So we definitely, from the Student National Pharmaceutical Association, our perspective is definitely the preventative side. We partnered with Shot at Life in 2013 when we had 3 students able to go to the Champion Summit, and they became Shot at Life champions then. And that's when we really saw what the organization was truly about and how students, even though we haven't had as much experience, we are, especially in pharmacy, on the front line of the grassroots efforts of spreading awareness. That's where we really lie. We really truly want to make sure we reach out to as many people as possible to spread the information that we do have about current vaccines, how they can help, and how important they are, you know, just for children to be vaccinated so early. So what we do is we take all of the information. We have our Operation Immunization group that works with Shot at Life on all of the different campuses. We have 86 pharmacy-affiliated campuses through the Student National Pharmaceutical Association, and we really spread the word about why immunizations are important and how important they are in getting vaccinated early. And then everything that we do, whether it's through Blogist or becoming champion summits champions, or through the webinar series, it's all about getting the work that we do here in the United States to be effective globally. So we're definitely about things that are happening in the United States, but how we can prevent childhood diseases in the United States and how we can affect things on a global aspect.
Great. Thanks so much, Danielle. And it's interesting to me that in 2014, I still meet family members and friends who are quite resistant to getting their children vaccinated. Just last week, I had a conversation with my cousin. This is someone that I think would be well-read and knowledgeable, who was asking questions about vaccinations. And I think there's so much disinformation out there that people have fear. And for my own life, I have 2 boys. My eldest has Asperger's and my youngest doesn't. And I can say just anecdotally from my experience that it's not the vaccinations that caused him to be on the autism spectrum. It's more likely the fact that I was an older mom. And I think that so many times people want to point the finger at something and vaccinations where they don't really understand the ramifications of not having your children vaccinated. Would anyone like to talk about just the misinformation and trying to correct that?
Well, I would just like to add to that I think we have a generation of parents who don't know what the world was before access to these vaccines were here. We're not hearing from people who lived through these diseases. My father-in-law had polio as a child. I only knew him in a wheelchair. There was a woman in North Carolina where I live who lived most of her life in an iron lung because of polio as a child. And I think these realities need to be faced, that to not vaccinate is a matter of luxury, and I don't think it's a luxury that our community can afford.
It's certainly unfortunate that there's so much misinformation out there, and that people have ready access to opinions and quote-unquote science that's nothing close to science. And you're pretty much allowed to say or whatever you want. You can write on the intranet, and I think that a hangout like this one really is an excellent opportunity for us to really make people understand that vaccines are safe, that vaccines have saved literally billions and billions of lives, and that we can't stop vaccinating or we will see these organisms come back with a fury. We've eliminated only smallpox from the world. All of the other diseases are out there just waiting to make a comeback. So we really need to be as passionate about our advocacy for vaccines and getting children immunized as others might be about concerns.
I think what really helped me to make this hit home for a lot of people that I've spoken to was I spent probably about a combination of 6 weeks back and forth to Colorado covering as a journalist the wildfires there. And when you talk to the EMS workers and you talk to those who are in charge of public safety, they say that a wildfire consumes fuel. And if you have one home that has done the hard work and cleared all of the trees and underbrush, but their neighbors haven't, they're going to be susceptible to a burn. And it's the same way with these vaccines. If you have all of these families vaccinating their children, but one family that doesn't, they make the community susceptible. And I think too often we forget that our opinions still have negative health implications. Danielle, I see you nodding. Do you want to jump in?
I think that's definitely true. I think all it takes is one person to spread one piece of positive information. I think that's really where the pharmacy students focus, is really making sure that we are that accessible group of students that can go out and say this information is not the most accurate, or let me help you to understand what about this is important, or feel free to ask us questions. We're definitely about accessibility, because I believe where the fear lies is in not understanding. And especially as a student, we have the time to be able to go out into the community, and there are so many of us that are able to go out and just talk to people one-on-one and be able to break down those fears and those walls where they don't understand. It's just, we necessarily can't financially fund all of the vaccines that are a necessity to have. However, we can give information because that's free. So.
And Dr. Meg, what do you say to the families who express concerns about vaccinations? How do you help them to see the danger that they're placing their children in?
Well, I think one of the most important things that we do as physicians and pediatricians is we try to listen to our patients and to try to understand what is the concern. And in many cases, if you simply ask, well, what is it that you're worried about, you can really change their mind by simply giving them the right information. So starting with an understanding, starting with listening, hearing what families are concerned about, trying to reassure them, and sending them to trusted sources of information, and using every opportunity where we meet them at any place to tell them, I think is very important. I'm delighted that the pharmacy students are really engaged in this. I think having young people, you know, sometimes the gray hair is looked at as part of the conspiracy, of which there is none, but, you know, as part of the problem, whereas a lot of people, if their peers talk to them and explain to them and understand the importance of this, not only globally, but even in our own area. We know that this year in the United States, there have been more cases of measles than in the last decade. And these are imported measles, some of them from travelers who have decided to not be immunized, yet go to areas of the world where there's measles, which includes France, Germany, as well as India, the Philippines, etc. So they go there, they get the measles, they bring it back, and because they've not been immunized, they are in a group of people who may have also chosen not to be immunized, and we see these outbreaks. There were outbreaks this year in Brooklyn. In the past, there have been outbreaks in San Diego and through the country. Now, you know, most children in the U.S. will survive measles, but the statistics worldwide are terrible. One child dying every 4 minutes. So we've been on this call, what, about 28 minutes? Think of how many deaths that is. How many children do not survive until they're age 5? And in Africa, parts of Africa, we know that children are not even named until they've survived measles. So clearly, we need people to understand that these pathogens are there, that we really want their children to reach maturity and to reach their best potential, and to do that without having infectious diseases. You can't always get them to understand, but there are many people, if you just start with asking, what is it you're concerned about, you can really change their minds. And hopefully some of the other people on the line have had that experience as well.
Alina,
sorry.
No, please go ahead.
We had a measles outbreak in North Carolina in the fall that was on the heels of a whooping cough outbreak as well. So I think having those kinds of things in the press did start to sway some people, at least have them explore what the options were and start to get educated instead of just standing by their vehement opinions, that they did start to branch out and say, okay, these things are happening in my community, and now that it's relevant to me, I'm going to start opening my mind a little bit. So I think, sadly, the more we hear about those things, the more it helps sway people's opinions.
Well, you make a very good point, and I'm thinking about, Alina, what you shared about your family members and the struggles that they've had falling victim to polio. What would they say to someone who has these life-saving, life-changing vaccines to encourage them to avoid the lives that they had to lead because of these diseases?
Well, you know, unfortunately, my father-in-law passed away before I became a Shot at Life champion, so he and I never had a chance to talk about these things. But I have spoken to other people who are in their 70s and 80s, and they just shake their heads saying, you young people today, you have no idea what the world was like. I remember my friends and neighbors and family members having polio and measles and whooping cough and feeling helpless watching these people you care about suffer. And when you have the means to such easy access to not have the suffering in the world, why would you not embrace that? And I think those are the kinds of stories we need to hear more of.
Yes, absolutely. And you know, even now looking at Shot at Life's Twitter, right now there's a tweet that says that gains have been made in child survival, that we're now at 48 deaths per 1,000 births, which when you think about that, 48 deaths per 1,000 births, it sounds shocking, but it was far worse than that. Dr. Fisher, can you help those who are listening to this hangout really put this into perspective of the gains that we've made, but the distance that we still have?
Well, I think for most people living in the U.S., 48 deaths per 1,000 is a unthinkable number. Our death rates are far lower than that. Our average survival is well into the 70s. But this is not true globally. And we really have become a global world where we need to be more thoughtful and more cognizant of what's going on everywhere in the world. We need to make sure that the Ebola outbreak in Africa does not stop all of our gains that we've made in immunizing children within Africa. We need to not go from crisis to crisis, but really try to strengthen healthcare systems so that everyone has the opportunity to be immunized. We know that worldwide the number of children who are not getting immunized is amazingly high. I have in vaccines in the I had the number here, but I can't put my hand on it. Here it is. 1 in 5 children around the world do not have access to any vaccines. So those kinds of statistics should make us all really rethink how we look at this and what can we do to help the global world, because children are the future of this world. We need them to survive and to survive undamaged by these vaccine preventable diseases.
Well, we only have 4 minutes, and so I'd like to invite everyone on our panel just to take 1 minute and just share a story of success. Let's start with Danielle.
Okay, so I can say that although, I mean, all the small efforts that we've made have definitely had huge successes, especially partnering with the Shot at Life Foundation. Last year, we were able to get over 1,500 petition signatures to co-sponsor Resolution 270 in advocacy for World Polio Day. So one small step, can make huge leaps and bounds as far as us being able to eradicate polio and other preventable diseases via vaccination. So I just would invite everyone to continue to be passionate, to take an individual step in the right direction to assist in this worldwide effort.
Alina, would you like to take your minute, please?
Oh.
Oh, we can't hear you. Are you there?
Sorry, I was muted. I was doing a Meg. Sorry. I think many small actions in aggregate turn into really large achievements. So I use my voice and my blog for communicating my own stories and anecdotes and experiences. And one of the things I did here in Raleigh was an Ignite talk about Shot at Life, and that got so many young people involved and ready to donate and want to become champions and become engaged in the process. And through my blog and through my talks at my son's school, one of the things his class did was they had an economics program where they made things and sold them to parents. And they, as a class, voted on where to donate the money, and their class chose Shot at Life to help other kids who were just like them.
That's fantastic. Starting with the youngest. And Dr. Meg, can you please share in a minute just a success?
So I think the successes are just really endless. We've succeeded in so many ways. We still have a long way to go. But for me, the big success is to see more and more young parents coming in and saying, which vaccines does my children need? Not being as hesitant. Really starting to say, we want to make sure that everyone that goes to my children's daycare or child care center is immunized. We want to make sure that my school requires children to get their vaccines because we don't want to see these diseases come back. And I think within the last 5 years, we've clearly seen a shift in the overall population and a real embracement of making sure that we're doing the best for our children here in the U.S. And I think that with Shot of Life and with UN Foundation and Gavi Alliance, we are beginning to really make a huge difference in the world. And we're getting close. We won't get to the Millennium Goal 4, but we're certainly getting close to diminishing childhood morbidity and mortality.
Well, thank you. Thank you so much, Dr. Fisher. Thank you so much, Danielle and Alina. Thank you so much, United Nations Foundation and Shot at Life. Thank you to Debbie Thomas and her amazing team. The success for me personally is being here today. And I am just really delighted to be here with my sisters, mothers, friends, being champions for Shot at Life. We hope that you will just take the information you've learned today and share it with your family, with your friends, at your work, at school. Continue the conversation that we do need to eradicate these diseases, that vaccinations absolutely do work. Let's make sure that every child lives past 5 years old and is able to do all the things that we're doing here today. They have a voice and we need to give them help. Thank you so much.
Thank you.
Thanks.